myself for 5 minutes. To Mr. Missel, the OIG has published several reports involving the Hampton VA Medical Center that substantiated many allegations related to clinical care. These reports highlight substantial failures to deliver adequate care, endangering veterans and undermining the trust of the Hampton Roads community. There was a 2022 report, multiple failures in test results, follow-up for patient diagnosed with prostate cancer, a 2023 report, delay in diagnosis and treatment for a patient with a new lung mass, and a 2024 report, mismanaged surgical privileging actions and deficient surgical service quality management processes. What has the OIG identified as being the root cause of these substantiated allegations, and to what extent were Hampton VA's leadership responsible for the facility's many failures?
I think the bottom line is the leadership is responsible for the failures that occurred. I think there was a theme in all three of these reports that some basic fundamental processes were just not followed. Some of them were just not even, the leadership was not even aware of it. And again, going back to what I was saying about VISN oversight, the VISN wasn't involved in the facility at all, never recognized that there were issues with leadership at the facility.
Why was the VISN not involved with leadership there?
They took a very passive approach, and they said they weren't aware of it. Nobody told them what the issues were. And we've seen in report after report, when there's passive VISN oversight, they're not able to identify problems as early as they should and to deal with them when they should.
Has that changed with some of the leadership changes that have happened recently?
We're still looking at that. We have open recommendations, certainly on the most recent report about Hampton, so we're going to follow up on that.
Please keep a close eye as the person who represents many of the veterans that use that facility. And follow-up question for Mr. Missel. In each of these reports, the OIG mentions a series of recommendations that the Hampton VA Medical Center must implement. Which of these outstanding recommendations have not yet been implemented, and have you received feedback from Hampton VA Medical Center explaining why hospital leadership has not been able to implement your OIG's recommendations?
We check with the facility on a quarterly basis to see the progress that they're making. The two earlier reports, I believe there's still one outstanding recommendation, but we understand the facility is working on it. And then the most recent report, it's too early at this point to have them closed out. But again, we're available to speak with the facility about any issues they may have, and we help them close them out and ensure that the recommendations address the issues and that the issues will be improved going forward.
So will you continue to follow up and make sure each of the recommendations have been followed?
Absolutely.
Thank you. And to Dr. Elna Hall, in your testimony, you state how the VISN's chief medical officer has been addressing issues at Hampton since August 2023. Over a year later, there's still clearly still issues present. So why did it take so long for the medical center director to be removed pending an investigation, and why has it taken so long to address these concerns?
I think those are very fair questions, Congresswoman, and I've been working with you and your staff for some time on all of these problems. It's never an easy decision to detail out a leader. Ultimately, our network director made that decision based on many of the findings that have accumulated over time with investigations from the Office of the Inspector General and the Office of Accountability and Whistleblower Protection. So when he recommended that decision to me, I immediately accepted it. And we made those moves for temporary reassignments and brought in a very experienced and effective leader, Walt Dannenberg, who's normally the director at Long Beach, California. I've already had contact with him about the improvements he's trying to make, and he is dead focused on making sure that things improve there for veterans at Hampton.
And we have met with him as well recently and are very encouraged by that leadership change. And I've only been in this position for almost 2 years now in my first term, but this has been the biggest issue that we have heard complaints about. We get complaints about a lot of things, you'd be surprised, but the VA healthcare issue for myself, representing one of the largest veteran populations in the country, it was unconscionable, just the number of not just patients, but the whistleblowers. I think we interviewed 25 whistleblowers from janitors to surgeons. So thank you very much for working with my office to rectify those issues and to provide new leadership. We are looking forward to also continuing to follow up them to make sure that we're seeing improved patient clinical outcomes. And then just to follow up, Mr. Allen Hall, Hampton currently has a dangerous shortage of providers as well. That was one of their issues. For example, employees have expressed concerns to my office about a dangerous and persistent shortage of personnel at the clinical laboratory, and the hospital currently only has one anesthesiologist on staff. What are you doing to ensure the staffing issue, specifically about anesthesiologists, is resolved?
Yeah, one of the immediate things is making use of a nationwide staffing contract vehicle that we now have called the Integrated Clinical Staffing Program. It turns out that we have a number of certified registered nurse anesthetists, but we need ultimate supervision from physician anesthesiologists, and so we're primarily trying to recruit through that vehicle. The most important thing to do is to get permanent anesthesiologists on, and we maintain our efforts to try to get those folks on permanently. I will again say that the $12 billion anomaly in the CR, which would go directly into VA healthcare, would allow us to grow our workforce instead of having to attrit our workforce to maintain within the budget. And so that'll be a very helpful tool to liberate every medical center that needs to bring in more clinicians, activate new services, and better serve the veterans in their regions. And we hope that Congress considers that.
And I ask that you allow nurse anesthetists to be able to practice to the full scope that they are allowed to practice. I think they are a great way to supplement that anesthesiology shortage. And I know that we have heard even in this committee setting just about the length of time that it takes to hire and bring on new providers. So just making sure that we are expeditiously doing the entire process and clearance and whatnot, but hiring them, because I think we lose some good providers along the way. And last question from me, Dr. Allen Hall. Some of the OIG reports at Hampton mention outdated software and EHR concerns as contributing to patient safety problems. Can you speak to what the VA is doing to modernize the VA's IT system to ensure veterans are receiving 21st century standard care? And specifically, I'd like to know what's being done to assist community care providers, outside primary care providers, the ability to have access to health information and patient safety flags. I know as a nurse practitioner practicing in a primary care setting, it was very frustrating. I could get charts and information and notes from all kinds of specialty care clinics. When it came to my veterans, I would look right at them and say, you've got to go there yourself, you got to get it printed out, and you got to hand carry it from the VA to our office, because I won't be able to get it, and all of my wonderful office staff won't be able to get it via fax or any other way. So that was a problem, and it created a lot of continuity of care problems. So what are you doing specifically to address that technology need in the 21st century?
There was definitely a contribution when it came to our technological tools on, this is really difficult to read some of these reports, but the really tragic case of a veteran with lung cancer who had serial delays in every step before they started treatment for ultimately what became a malignancy that spread to other organs. And part of that was the tools needed for referral into the next step and making sure folks were in scheduling queues when they needed to be. I think the bigger contributor, though, was reliable follow-through on our processes and holding all staff accountable for following through on every veteran, but in particular, veterans with serious diagnoses like cancer. Of course, we're trying to improve our systems around scheduling, so we have a lot of work going in collaboration with OIT to make it easier to schedule veterans into every subsequent step in their care. One specific move we're making is to do what's called provider-based scheduling, which allows you to see all the options for any physician or clinician available in any number of their clinics that they work in across the VA. We hope to go live with that soon, and that'll significantly reduce the task flow burden for every single person trying to coordinate that veteran's care. That's just one of many examples of some of the tech tools that will help us. We're still primarily accountable, though, for follow-through for every veteran with the tools that we have.
Thank you, and I look forward to continuing to work on the EHR integration throughout the VA as well. And then just one final question, just because this has been a topic that's come up multiple times, including in the media in my district, but that's with community care, specifically for chiropractic care. And what we have advocated on different levels, including meeting with the new executive director about that approval process. And for some reason, chiropractic care is always the one that's highlighted. But I believe, as a nurse practitioner, again, that we should be able to treat the veteran with the pain modality that they respond to the best. If it's chiropractic care, great. If it's physical therapy, if it's medicinal, whatever that pain modality is. But why can't we get that approval process done so that our veterans who respond best to chiropractic care can continue to get that chiropractic care. I don't want them to resort to other types of we see overdose issues, we struggle with mental health issues. Let's get our veterans the proper treatment with the pain modality they respond to, and if it's chiropractic care, it should be that. So what is the VA doing to address that issue?
So, Congresswoman, I'd say that this occurs most of the time when it comes to our employees trying to assist every veteran with the next best step in their care. We have to, though, make sure it happens every single time where we engage the veteran in care decisions. If a veteran tells us that chiropractic care is assisting with their pain and their function, we should do everything we can to honor that. Now, there may be sort of many dimensions of your question around how requests for service are approved to continue a community care episode, making that initial decision to refer a veteran to the community if we don't have chiropractic care. There's a lot of ways to tackle that, but we need to just be extremely veteran-centered on how we improve these processes, and that's my commitment to you.
Thank you very much, and I agree. All right, and Chair now yields.